All right, well, thank you. We are here today because when it comes to public health, families and healthcare providers in Washington State and really across the country need a clear, science-based information, and they need transparency. That's what the CDC is for, to give families the facts and issue recommendations based on science, not politics. But as we all know, President Trump decided to hand the keys to CDC to an anti-vaccine activist with a premeditated agenda to burn down our public health agencies from the inside. What RFK Jr. has done is demolish decades of trust in just a few short months of conspiracy-fueled chaos. The damage cannot be overstated, and as long as he remains in power at HHS, it cannot be undone. He has been methodically dismantling our public health system, consequences be damned, and continues to push out scientists and experts who refuse to put his cuckoo bananas nonsense over decades of hard scientific evidence. First, RFK Jr. fired every member of CDC's Vaccine Advisory Committee, every single one. These were highly qualified and credentialed experts who truly understand vaccines and public health. People like Dr. Helen Chu of Washington State, who was just one of the advisory board members unjustly fired because RFK Jr. wanted his unfounded conspiracies to take precedence over actual facts. And after he sent the experts packing, RFK Jr. started stacking the Vaccine Advisory Board with a smorgasbord of anti-vaccine kooks. People who are unqualified, people who are conflicted, people who are just conspiracy-brained. And right off the bat, they started advancing anti-vax theories and even policies to limit access to vaccines. And when the Trump-appointed CDC director actually stood up and said, you know what? I'm not here to follow RFK Jr. down some rabbit hole. I'm here to follow the science. I'm here to protect families. He fired her. And this was a CDC director that RFK Jr. picked himself. What is happening at CDC and across HHS is not some theoretical danger for families. Right now, there are people who want to get the COVID shot and can't. There are parents looking for the facts about how best to keep their kids safe. But now those facts are buried under an avalanche of misinformation, including from our nation's highest health official. The American people need transparency. They need accountability, and they need action. I have been pushing, and we are making some headway, at least on transparency. Next week, we will have a Senate hearing with the CDC director that RFK Jr. fired. That is going to be a critical opportunity to shine a light on RFK Jr.'s dangerous meddling. But we can't stop there. We need answers to all the questions about what exactly RFK Jr. is doing to interfere with the science at our top health agencies, which is why I will be calling for an OIG investigation into the ousting of top officials at CDC and new restrictions on vaccine access. And just as important, we need accountability. That means RFK Jr. needs to be fired. And it means the real experts need to be put back in place. So I'm not going to stop pushing. I'm not going to stop holding his feet to the fire. There is so much at stake. And as that fight continues in Washington, D.C., I am especially grateful that experts in Washington State are stepping up to fill the leadership vacuum that is being created at the federal level. And I'm pleased to have some of them joining me today, because there are people right now in Washington State wondering, should I get my kids vaccinated? Can we even get the vaccines we need? And there are doctors wondering, what does this mean for my patients? These questions cannot wait for RFK Jr.'s reign of chaos to end. They need clear, science-based answers now. That is why efforts like the West Coast Health Alliance and the Standing Order on Vaccine Access in Washington State are so important. I'm glad to see Washington State step up yet again to protect against the Trump administration's chaos. But as we all know, diseases do not stop at state borders. That's why we still need a functioning and trustworthy federal health department, and for that to happen, RFK Jr. must be fired. Now, I'm delighted today to turn it to Washington State Health Secretary Dennis Worsham, who will talk more about how all this chaos affects Washington State and what efforts are being taken in our state to protect vaccine access. Secretary Worsham, over to you.
All right, good morning, and thank you, Senator Murray, for your leadership on public health. It's been a long time and consistent, and we really are grateful for all that you're doing and advocating for our public health and the health of Washingtonians. I want to begin with a story that I think is actually really relevant to what part of the topic that we're talking today about, assuring access to all folks. The story is really about a woman named Nora and her 12-year-old who was a great athlete here in the state of Washington, was a sprinter, played soccer, and stepped out onto a field and became quite sick from COVID, and that changed everything for this poor child. After the first infection, this healthy, vigorous, and young athlete went from racing for personal battles to struggling to catch their breath and climbing even a flight of stairs. Recovery from long COVID didn't take weeks or even months. It took a full year. And by that time, her friends and family on the track had moved on, and this child was left behind. As a mother, Nora deeply was worried the virus had sidelined her child, and that same virus was still circulating. And what did this mean for other kids or even Nora's child? She even grew even more concerned around vaccine limitations that we saw come out of the FDA earlier this month, and really limiting vaccine access to anyone who's under the age of 65 years old. When Washington State Department of Health issued its standing order, Nora finally felt some sense of relief. She shared with us, "I want everyone to know that the COVID vaccine isn't only for those who are immune compromised or elderly. It is also for the average Washingtonian who wants to protect themselves and their families from serious illness and long-term complications." Her message is simple but powerful. Youth and athleticism is not shields against this virus. Children also deserve access to prevention. Our decisions to create the West Coast Alliance and issue standing orders for COVID vaccine were direct reactions to the immediate lack of access that is happening right now in Washington and across our great country. Days after the FDA issued its limited recommendations, reports surfaced of major pharmacy chains requiring prescriptions or halting COVID-19 vaccines altogether. Last season in the state of Washington, over half of our COVID vaccines were administered at pharmacies. So these federal restrictions directly threaten the ability to access for preventative care for those who want it in the state of Washington. And even when these vaccines are available, the federal limitations that came out from FDA leave out key populations such as children, adults with immune-compromised family members battling from cancer or are recovering from a transplant, healthcare workers, teachers facing daily exposures, caregivers protecting elderly relatives or living in multi-generational households, and anyone hoping to avoid long-term effects of COVID, like the ones that devastated Nora's child. The standing order that you mentioned was issued by the State Department of Health officer here, and assures that everyone or anyone 16 months and older can receive a COVID vaccine without the barrier of needing a separate prescription. For many families who don't have established providers, or even for those of us who do, oftentimes accessing our own clinical services may be difficult. This means this standing order now gives us the ability to go directly to the pharmacy or a clinic of your choice and get vaccinated, as they always have. It preserves that right for people to make that decision for themselves. There is a lot of chaos right now, as you mentioned. Families must be able to count on consistent evidence-based recommendations, and that is the very reason why Washington, Oregon, California, and Hawaii established the West Coast Alliance. This partnership ensures our states continue to receive science-driven vaccine recommendations in aligning with respected medical organizations like the Academy of Pediatrics and the American College of Obstetricians and Gynecologists. And we're working to preserve those access, respect each other's own authorities in our states, but working collaboratively together to provide clear, consistent messages based on science and evidence. This provides families and providers with consistent and transparent information they can trust. The FDA's recent recommendations mark the first clear departure from science-based policies, and more deviations are expected. Meanwhile, Instability in our federal institutions, as you well noted, continues to escalate. The dismissal of CDC scientists and doctors, the removal of the entire Academy Advisory Committee for Immunization Practices, and policy shifts without input from subject matter experts reduce transparency on decision-making, recommendations, and it really breaks the Americans' trust in who to rely on. Our nation's ability to prepare for respiratory and virus season is now in jeopardy, and other infectious diseases that really threaten the public's health. Public health at its core is about prevention, preventing illness, preventing the spread of disease, and preventing avoidable deaths. As the Secretary, I promise to the people of Washington that we will not compromise on this value. And when the health of Washington and families are on the line, we will act decisively, urgently, and we will protect the health of the well-being for all people to make the best decisions for their own health. So thank you so much for your support, and I'm going to turn over to Dr. Vin Gupta.
Thank you, Secretary. Thank you for your leadership. Senator Murray, thank you for having me, and for everybody here. It's great to be here with Dr. Ove from the American Academy of Pediatrics. I'm a pulmonologist here in Seattle, and I've had the pleasure of both caring for patients in the civilian world and as a reservist at Joint Base Lewis McChord. So I've had a chance to see in a variety of different clinical settings the impact of, for example, not getting vaccinated to one of these viruses can have on somebody that might otherwise be healthy. I wanted to start there. Doctors and nurses across the country are not supportive of what we're seeing from Secretary Kennedy and from his administration. He said that in his Senate hearing, for those of you that actually witnessed it, he actually claimed that doctors are supportive of what he's doing. And the people that he should be most accountable to, nurses, respiratory therapists, medical providers like docs, you name it, he should be most accountable to them, because we are the ones that are dealing with the impact of his policies in hospitals across the country, whether they're ERs, whether they're ICUs. We directly deal with the consequences of bad policies, of enlightened policies. We benefit from those. And we're angry. There's a reason why 79 medical societies and entities like the Common Health Coalition and similar like-minded groups are upset. 79 medical societies, including the American Academy of Pediatrics, were represented by the Washington chapter here today. Had a chance to speak to the president, Dr. Susan Presley, just a few weeks ago. Everyone is angry at what is happening. I'm on the board of the American Lung Association. No one likes what we're seeing here because it's going to impact vaccine access. We're already seeing exemptions for vaccines for non-medical reasons in places like Florida increase at a clip that's alarming. For polio or for measles, for tetanus, for childhood illnesses that could really run rampant if we don't have herd immunity, which is about 92%. At minimum, we want 92% of the community to have immunizations against these childhood vaccine preventable illnesses. We want to make sure that we have broad adoption. If we don't hit that number because of exemptions or because of terrible policies like what the Florida Surgeon General did just last week, we're going to see an epidemic of diseases that we haven't had to really deal with in our lifetimes, because vaccines have rendered them something that we haven't had to worry about. But now we're really talking about vaccine access, as the Secretary pointed out, being squarely at risk because pharmacists are confused about what they can and cannot do within a retail pharmacy right down the street. I don't think people really recognize that when the advisory committee on immunization practices cannot meet because they're not allowed to meet, or because it's not fully populated with experts, the CDC can't endorse a recommendation. And what does that mean? In 16 states, CVS and Walgreens says, you know what, we can't actually distribute the COVID vaccine. As the senator pointed out, and as the secretary pointed out, other workarounds have had to be developed, like the West Coast Health Alliance, like standing prescriptions for vaccines like we've done here in Washington State, to go around this terrible policy. But make no mistake, vaccine access is squarely at risk. Pharmacists don't know what to do in many states. They're confused because the law requires that we have to have ACIP CDC alignment on vaccine recommendations. And as a result, patients don't know if their insurance is going to cover their COVID vaccine, especially if they're medically higher risk. They don't know if they're going to get the flu shot this year because no one's talking about it. I've even seen Senator Rand Paul talk about the hepatitis B vaccine and whether it's medically necessary. So make no mistake, this is the canary in the coal mine. This is just the beginning. Number two, just real quick, promising technologies like mRNA vaccines. We're seeing $500 million that was previously allotted by the Biden administration to develop this technology for critical areas of research, like preparing for the next pandemic. And we're hearing about avian flu change right before our eyes. We need these nimble technologies to be able to respond rapidly if we have to deal with another epidemic or infectious disease that might pose a threat for the next pandemic. We need these emerging technologies because they allow us to develop vaccines that can allow us to respond quickly in real time within just a matter of months. That's why these technologies exist. But they don't just exist for infectious diseases. They also exist for chronic diseases like lung cancer. mRNA vaccines were being developed for the leading cancer killer in the United States around the world, lung cancer, and now suddenly all that money is being put towards other priorities. People really need to realize here that what's happening at HHS is going to impact all families, whether you're a Republican or whether you're a Democrat. You want to have these technologies, these new treatments available to you and your loved ones should you need it. And it wasn't just about the COVID vaccine. It's about treatments and preventatives for diseases like lung cancer, pancreatic cancer, avian flu. There's a whole range of things that are now at risk. And I'll lastly close just by talking about the MAHA draft agenda that was just published. They just published it earlier this week. Many of you probably saw it. Talked about ultra-processed foods and needing more research into ultra-processed foods. Talked about pesticides in agriculture, needing more research into pesticides and its potential link to poor human health. It's nonsense. We already know what these ultra-processed foods do to the human body. They're not good for the human body. We already know what pesticides do to the human body. They're not good. The Secretary of Health and Human Services when he ran for president, said he was going to do something meaningful, like putting labels on ultra-processed foods so the American public knew what was good and what was potentially risky for their health. He has shied away from any meaningful access, as this MAHA agenda is showing. There's no substance there. It's talking about fluoride in water, vaccine research into autism, things that we knew were his pet agenda projects for many, many decades. That's what this is really about. It's not about meaningful change. He talks about wanting healthy food for kids in schools. He's going to do that while simultaneously defunding SNAP through the cuts in Medicaid. How is that going to work? He's talking about safeguarding air quality and water quality. How are we going to do that when the Trump administration is defunding the EPA? It's filled with contradictions. None of this makes sense. Doctors and nurses are not aligned with this. We're all very, very upset, very angry, and that's why we're here today. With that, I'm going to throw it over to Dr. Rave.
Thank you, Dr. Gupta. My name is Lilach Rave. I'm a pediatrician. I'm the interim executive director of the Washington chapter of the American Academy of Pediatrics. And I'd like to talk to the parents who are out there today, because that's what we pediatricians do. We talk to parents all day, every day. In the 25 years since I finished medical school, I don't think I can even count how many parents I've met. I get it. Parenting is the hardest job in the world. There is nothing more daunting than being responsible for a tiny, helpless new human, usually without an instruction manual and while you are sleep deprived. The parents I meet love their children fiercely. They will do anything to protect them. But recently, it's become harder and harder for many parents to figure out how best to do that. Families are swamped with messages, many of them scary, many of them contradictory, as Dr. Gupta just said. That's why I want to really emphasize what RFK Jr.'s lies and restrictions really mean for kids and families. With those lies and restrictions, vaccination rates go down, and when vaccination rates go down, kids get sick. We'll see more children in the hospitals, more children suffering, and in some cases, children dying of diseases we know how to prevent. Measles infections, for example, are at the highest rate in over 30 years. Children are uniquely vulnerable to diseases that vaccines prevent, and vaccines are one of the greatest public health successes of the last century. Global immunization efforts have saved an estimated 154 million lives over the last 50 years. That's about 6 lives every single minute of every day of the last 50 years. Most of the lives saved were infants. That's what's at stake here. Let me give a real concrete example. The FDA no longer recommends COVID vaccination for pregnant patients. But infants under 6 months who are too young to get vaccinated are one of the groups hospitalized with COVID most often. Their hospitalization rates are equivalent to the rates we see in people over age 75. The best way to protect those babies is through vaccination during pregnancy, which our federal government no longer supports. So without that, we're leaving our most vulnerable children exposed. These unscientific changes in vaccination guidance are having real effects on kids. So I urge you, turn to your pediatrician. We have spent years learning about children's bodies, their diseases, their development. We chose this work because we care deeply about children and families. We don't expect you to have all the answers. We want to be your partners as you navigate these times, which can feel confusing and uncertain and scary. We, all of us here on this call, want your children to grow up happy and healthy and thriving. We are really fortunate in Washington to have leaders like Senator Murray on a federal level and Secretary Worsham on a state level, who are working to make sure that kids have access to the best evidence-based care possible. We are all on the same team working to keep your kids safe. So with tremendous gratitude, I want to turn it back to Senator Murray. Thank you.
Well, thank you all to all of your excellent input. I so appreciate it. We've got a lot of work ahead of us, and it is great to be partners with all of you. Naomi, I will turn it over to you to call in reporters for any questions for any of us.
Hi, thank you, everybody. Thank you, Senator Murray. If you just allow a question on a different story that's just in the news everywhere this morning, I'm wondering if you have any comment or thought on the arrest of a suspect in the killing of Charlie Kirk, and your thoughts on the political moment in the country?
Can you identify yourself for everybody first, and then I'll be happy to do that.
Sorry. Thank you. I'm Jason Pagano with KOW Public Radio in Seattle.
Yeah, thanks, Jason. Look, political violence is never acceptable, ever. We use our voices, we use our votes in this country to express our views, and violence is never acceptable. I'm glad it seems that they have caught a suspect. I expect the system to promptly go through their process and do it in the right way, and I'm glad that's happening now.
Alrighty, not seeing any other questions from the audience. I want to thank everyone for taking the time to attend this morning, and this call was recorded and video will be distributed widely, and I'll turn it over to Senator Murray to close us out.
Let me just thank all of you for participating in this again today. It's so important that we get this information out to parents and families. I have been contacted by so many people who don't know if they can go get their COVID shot. In Washington State, we're working hard to do that. The confusion, the lack of understanding people's worries about this, it is really important that all of us speak up, speak out, and keep going. I know I will, and I want to thank all of you for doing the same.